So first of all, let me welcome you all here. I'm Ken Thorpe. I'm the Executive Director of the Partnership to Fight Chronic Disease and also a professor at Emory University in Atlanta. We've been doing a series of briefings looking at different ways that the Congress could improve quality and save costs. And we've done a couple of them looking at the role of prevention, that is averting disease in the first place, and the potential savings of the Medicare program of so doing. And have been doing a lot of estimates on looking at the potential that evidence-based care coordination could have on reducing costs among dual eligibles and in traditional fee-for-service Medicare. We think the potential there over a decade is about $250 billion on net if we actually introduced care coordination into the program, to me, that needs it the most, which is traditional fee-for-service Medicare, which does no care coordination. The point of our briefing today, however, is that none of this works if we don't have the ability to exchange information across providers. Therefore, the role of health information technology is a critically important one in making sure that if we are going to do team-based care and care coordination, that we have the capacity to have really top-notch health information technology. So you're going to have a terrific panel here that you're going to hear from in a minute of innovators in the HIT space. They're going to give you some examples of how they're using information technology to coordinate care. And I think that you're going to find their presentations very interesting. So I'm going to introduce them in the order in which they're going to speak. The first is Doug Gentile, who's the Chief Medical Officer of Allscripts. Is also a practicing emergency room physician up at Fletcher Allen in Burlington, Vermont. Our second speaker is going to be Corey Kruger. Corey is the Assistant Medical Director of the Institute for Quality, Innovation, and Patient Safety at the Marshfield Clinic. Certainly one of the innovators that we've looked at is trying to model some of the care coordination that we've been proposing. And our last speaker will be Lori Russell, who's the Vice President of Quality, Strategy, and Outcomes for one of the special needs plans, XL Health. So without further ado, I'm going to go ahead and turn it over to Doug.